Hello and welcome everyone. My name is Sadia and I am one of the program coordinators in the Ontario branch. And thank you for joining this session on young adults transitioning out of pediatric care. Before we begin, I'd like to review with you how to participate in the session. Please feel free to enter any questions you may have throughout the presentation. We will collect those questions all at the end of the presentation, and we will address as many as we can. You'll also have an opportunity during the Q&A period to ask questions live as time permits. We invite you to send any further questions to kidneyprograms@kidney.ca. Please remember that the Kidney Foundation is not able to offer medical advice. For specific information about your own situation, please speak with your healthcare team. And now it gives me great pleasure to introduce to you our moderator for this awesome session, Anna Godzik. Over to you.
Hi, thanks, Sadia. I'd like to wish everyone a happy International Women's Day. It's a special day for all of us here. So my name is Anna Gosdick, and I'm the nurse navigator for the University Health Network in Toronto. I've been a member of the transition team, which includes a social worker and a dedicated kidney doctor at Toronto General Hospital since 2014, when the Sick Kids Transition Clinic was established. In my role, I meet patients at Sick Kids and support them until they are seen in the adult kidney care clinic. Today, I'll be joined by Kwalit from the transition program at Toronto, the Hospital for Sick Kids in Toronto, our young adult, Brennan, who will be transitioning from pediatric care, and his mom, Tina. Before we meet Brandon and Tina, I'd like to hand it over to Khalid to start us off about how the transition program within the pediatric team works, who's involved, and how to prepare young adults and their families. I will then talk about the transition program at UHN and at the adult care. Khalid?
Okay, let me just share my screen. Perfect. Okay, thank you, Anna, and welcome everyone. We appreciate you for joining our breakout room today. As Anna mentioned, my name is Khalid Baru, but everyone calls me Q, both at work and at home. Okay, so my role, I'm currently employed at the Hospital for Sick Children under the Division of Nephrology. I work as the social worker. I work specifically with the chronic kidney disease population and the hemodialysis and peritoneal dialysis population. As Anna mentioned, our transition process, our transition process for CKD patients and dialysis patients somewhat differ. So I'll spend my time today talking about the two processes before handing it back to Anna. Okay. So the CKD transition process started in collaboration with the Toronto General Hospital team back in 2014, with the official clinic first clinic running in 2015. Anna will speak more to how and why the clinic came to fruition, and I will use this time to discuss how the clinic runs. So I chose the photo that you see here today because I feel like the CKD transition process runs like a well-oiled machine. There are a lot of moving parts and team members who work together to ensure our patients and families feel supported by us, their CKD team, in preparation for their transition to the adult healthcare system. We hold 2 transition clinics each year, typically in the new year and in the fall, so January and September. But if it's indicated, for example, we have more patients, we will hold additional clinics throughout the year. The clinic is held specifically for our 17-year-old patients, and their parents or caregivers are always welcome and are encouraged to participate in this clinic. Okay. So before I talk about what happens in the actual clinic, I want to say that we're fortunate enough with our CKD patients to get to work with them for a large majority of time, starting with when they're young and as they grow into adolescence and into adulthood. So we have a lot of time to get to know them. And because of that time, we use our clinics to foster patient independence and autonomy with their care. So we look at the patient's capacity and typically start from the age of 7. And what we do is we include them in discussions around in the clinic and around, for example, taking their meds, what is the use of their meds, asking them about symptoms, and really giving them a voice in the clinic so they feel like they're a part of the team and that their voice matters in what we do. So it's also to promote comfort and confidence in speaking with the medical team and for them to have personal awareness of their health. During the actual transition clinic when they're 17, the patients and families meet with our team, so they're familiar with us, that's the staff nephrologist, their nurse practitioner, the dietitian, and myself. And they meet the Toronto General team at Sick Kids in the nephrology clinic. So it's an environment that's already familiar to the patient and their family, so it's less intimidating, preparing for that next step. From our side, there's always a medical discussion about like what to medical background and what to expect, but we also like to highlight patient and family strengths and needs. Each family comes from different backgrounds, socioeconomically and culturally, and that lends to different perspective in terms of, what would be helpful for them as they prepare for their transition. Our patients and families also have time during this clinic to address any questions or concerns they have about moving to the adult side. So that could just be about, where to park, where to go, where's the clinic. So any worries or concerns that they have this time to also, speak to the Toronto General team, and while also having us, their support system, there to help them, guide them. Following the clinic, our patients typically have about 1 to 2 clinics left with us, and we use that time to address any outstanding questions or concerns and support needs to further promote and prepare for their first adult appointment. If needed, it hasn't been indicated to date, but we can also accompany, since it's just across the street, our patients to Toronto General. That said, not all our families live in the downtown core, so it's not to say that every single one of our patients and families will go to Toronto General. So in those instances, we'll have our nurse practitioner connect with Anna about what is the most appropriate local health center, and then we try and kind of collaborate and facilitate the same process. And they may not be coming to the clinic, but the adult team may not come like Toronto General, but just facilitate a similar format to ensure our patients and families feel supported. Okay, so what's new? So while the CKD transition process is what I feel a well-oiled machine, our transition process for our dialysis patients is relatively new in terms of formality of the clinic. We've had patients in the past successfully transition without having the whole team come together and meeting with Toronto General, but I think we've, in the past couple of years, noticed that this was a gap and thought this is something that we should work on. So it really triggered this, I think, for our hemodialysis and peritoneal dialysis patients was, I think, COVID. COVID really, we weren't having transplants, so more patients were going over to the adult side, because typically our goal is to always transplant our dialysis patients. But with the stopping of transplants and then precarious rules around visitors that we weren't all clear about on the adult side, we decided let's do what we can to prepare our adolescent patients for the transition. So at first, what we did was we transitioned through staff contacts, but we were later able to collaborate with Anna to get key members from both the PD side and the HD side to support a fulsome clinic. We don't have set clinics like we do in CKD, just because, again, the goal is to hopefully have everyone transplanted. But in instances where patients are not ready to get transplant or open to transplant, then we'll kind of have a more formal process about, maybe 2 months before, 3 months before, we're going to meet with the adult side to set up a clinic. And what we do is we look at the patient location. And again, we work collaboratively with other health networks that that are more local to the patient and family to ensure that they're able to meet their needs and they're not coming all the way down to sick kids. If, for example, they live in Oshawa or Whitby, because this isn't always the most local. And if you're coming to dialysis 3 to 4 times a week, you want to be somewhere close to home. Our HD team and PD team are relatively similar. There's always a dietitian, staff nephrologist, myself, and then the nurse. So our PD team, there's 3 nurses that work with our patients, and then our HD team, each patient has a primary nurse. So because we see them relatively often, with our hemo patients, we see them 3 or 4 times a week, and with our PD patients at minimum once a month, we have a lot of opportunity to work collaboratively with them to foster independence and confidence with their care. I'll touch a little bit more on like what we do on the next slide, but just when it comes to the actual transition, I find with our hemo patients, we will accompany them to Toronto General for their first clinic, unless the patient, has said, we feel comfortable and are confident doing this on our own, or we'll participate virtually. When the clinic is, for example, we had a teen going to Lake Ridge, our team jumped on the call virtually and we're there with them for their first clinic. So we weren't there in person, but they felt supported by having us, their primary team for so long, a part of that experience. Okay, so we, with our teens in our transition process for our dialysis kids, we use the Good to Go guide. So similar, to backtrack a little bit, similar to CKD, we also start young and including them in their care, asking them questions and making sure they feel autonomous. But really when they reach 15, 16, we start to get them to run their clinic independently. So they meet with the dietitian, myself, the staff nephrologist, the nurse on their own, and we encourage them to have a notebook, a pen, write down any questions. If there's concerns that they have, or if there's something that they don't know, to make note of it and to come back to us next clinic after following up with their parents or sending an email saying this is what was outstanding from our clinic. So we do this because we really want to promote patient education and knowledge of their care and want them to feel like they have ownership of their care. By the time, but when it's time for them to transition, they're able to comfortably, address the medical team, ask questions, ask for refills, report on their meds, and really feel like they can do this. And this is not to say that we don't encourage parents and caregivers to be a part of these clinics as well, because we also look at, needs of the patient. If there's developmental needs or if there's no capacity, we try our best to work with the patient where they're at to ensure that they feel as supported as they can in this process. I think what we noticed was that parents were a little bit reluctant at the beginning of having these clinics independently for our dialysis kids, but I think with time, they really found it to be helpful and appreciated that their teens were establishing a new skill set, even as something as simple as like talking to a doctor was something that they were fearful of in the past, or asking for support or raising a concern. Just seeing their teens establish these skills was really beneficial for the parents, and they really started to buy into this part of our transition process. And then so, luckily, like some of our kids do get transplanted, which is always the goal. And what they do leave with as a teen, they leave with these skills that can go to their transplant team and again, go on to the adult side transplant team. So even though they may not be transitioning to the dialysis side in terms of the adult health care system, the skills that they get will follow them along with whatever team that they go, because with chronic illness, it is lifelong. Okay. And then additional resources and supports. Our patients and families are always encouraged to, reach out to Allied Health in hospital, but also the Kidney Foundation. We really promote the peer support group and want our patients to know that there's other teens and for parents as well to connect with others who are going through similar experiences and challenges that they are going through. Okay, and then my last slide, we're all in this together. So I guess for me, my take-home message for everyone is that we're all a part of a team. We can't do our jobs without patient buy-in and caregiver support. We appreciate patient and family feedback, and hope that patients and families know that their voice is important and their role as a team member is vital, and that we need them just as much as they need us. I think we need you guys more. So we couldn't do this without you, and we really appreciate everyone coming together for the sake of for the patient.
Thank you, Q, for those insights and describing how you prepare your young adults as they transition to adulthood. I want to now share how we in the adult side help support patients. I'm just going to share my screen. So my name's Anna Gosdick. I'm the nurse navigator for nephrology. And what that really means is I help patients navigate the healthcare system. So that's where my role title comes from. I want to talk about how this all started. At Toronto General Hospital, our transition journey started back in 2014 when our team acknowledged that we were really struggling to understand what the special needs were of young adults who were just transferred to us from sick kids. And there is that difference in words with transition and transferring. We didn't have a standardized process, and we were just making assumptions about what patients and families needed. And we would just get paperwork faxed over to us, and we would read it on our own. We decided to form a partnership with the Sick Kids Kidney team, and came up with a plan and used strategies that were already being used at other clinics at University Health Network. For example, the kidney transplant clinic staff were going over to sick kids and meeting patients at Sick Kids Hospital for a transition clinic. And the red blood cell clinic had tours of Toronto General Hospital with sick kids staff prior to transferring to adult care. Like Q said, we had our first transition clinic at Sick Kids in 2015. And that included the Toronto General team of the kidney doctor, the social worker, myself, meeting patients and their caregivers at Sick Kids. So a successful transition is defined as uninterrupted, coordinated, developmentally appropriate, psychologically sound, and comprehensive. So obviously this is a very academic definition, but this is a reminder for us what really we should be aiming towards. We adopted new strategies that we weren't previously doing in order to have a more seamless transition. So what this really means is that when young adults transfer care from pediatric to adult care, the care is continuous, and that means we have a two-way communication. There are people involved to help make the transition easier, that each young adult is treated as an individual, and that their needs are met. And so this is not just medical, it includes the psychological and the social aspect of care as well, and that's important. So what we observe is that every patient's different. We also understand that this is a time of mixed emotions. I had a patient who came in for her first intake appointment with me and was taking notes, asking questions, and her mom sat back and encouraged her. This patient eventually was able to manage coming to appointments on her own, would reach out to us if she needed anything. On the other hand, I have patients who also participate during their intake appointment, but rely on their caregivers so that they help supplement information or really look to them for information and help. And lastly, we also have patients who developmentally are not able to and may never be ready to fully participate in their care, and their parents continue to be part of their care through adulthood. We understand that every young adult is unique, and you may not be ready to take all of your care over just because you turned 18 years old last month. So we understand that. We encourage families and caregivers to participate during your transition. And we understand that having that caregiver support is important, and we really welcome it. We will start asking you questions directly. We'll ask you to start taking part in decision-making. We'll ask your permission to speak to your caregiver. We want to find out how you prefer to be contacted. And if you want us to call you directly, if you want us to use your caregiver as a backup if we can't reach you, or maybe you want us to email both of you at the same time. It's really up to you. I wanted really to emphasize that it takes a team. Just like you said, there are teams in healthcare, and this is our team. I'd like to acknowledge them and their work with our young adults who transition to Toronto General. I want to encourage you that you have access to many different resources in our adult hospitals, and please just ask us. At UHN, we are lucky to have sick kids just across the street, so it makes the transition period a bit easier. But we want to acknowledge that it's not all the same for young adults, especially if you live in an urban setting or in a more rural environment. I want to encourage you and that it is your pediatric team that can advocate on your behalf and make those connections with adult teams prior to you turning 18 and have a plan in place. With the pandemic, we really have learned that virtual care is possible. We prefer to meet patients in person, but if pediatric teams need to connect with adult team closer to home, it is possible to do this virtually, and now we've really become experts at this. How our transition program works is that we first meet you in an environment that you're comfortable with, and Q mentioned this as well. The kidney doctor, the social worker, and myself go to the kidney clinic where you're already comfortable. We take time with patients and their caregivers to explain how adult care is different from pediatric care and ease any fears and anxieties by giving you opportunities to ask us questions when we meet you, and also give you our contact information so that you can reach out anytime. And we've noticed that really just having our contact information relaxes caregivers. So at a minimum, that's something that can be done. We created a pamphlet that we use specifically for our sick kids transition patient to highlight some of the differences between pediatric and adult care and try to make it a little bit more fun and exciting than our adult pamphlet. And so this is something we give to patients when we first meet them. Over the years, we've really found that caregivers are getting more and more tech savvy. And so they've already found our website and before we've even met them, but we just want to make sure, the patients know where to go, or if they don't, they have our contact information. Our clinic at Toronto General includes a kidney doctor, nurse, social worker, dietitian, and a pharmacist. After our first meeting at Sick Kids, I meet with patients and their caregivers at Toronto General for an intake appointment. I'll orient patients to the space, the routine, and how our clinic works. When we first meet you, we'll always clarify if you have a family doctor and discuss this with your pediatric team. In our specialty clinic, we will only be able to look after your kidney-related problems, and we want to make sure you have that connection with your primary care provider, so such as a doctor or a nurse practitioner, for all of your other needs. We take time to find out if you're in school or if you're working. We encourage patients and their families to give us a call if the appointment time doesn't work for you. You can reschedule your appointment so that you can write your exam or go on that family vacation you've been planning. Many of the calls I receive after I first meet patients at Sick Kids are just like this. Where can I do my blood work? Can I reschedule my appointment? I have a trip coming up. Just ask us. We want to make it as easy as possible for you. We give you information about our clinic and how it works. You have a chance to meet with me again before your appointment to ask questions again. We understand that every patient has unique needs and worries, and we have a partnership with patients, families, and caregivers. It's not a one-way communication from the treatment team to a patient. We ask you to take an active part in your treatment. We work closely with the Kidney Foundation and refer our patients to the peer support program, and that's both for patients and caregivers. The Kidney Foundation has a wide range of resources across Canada, and they can help during this transition time as well. We want our young adults and their caregivers to be more comfortable to ask us anything. We give a chance to tell us if something's not working or if you have questions about your medications. We want to know if you have any fears or questions about certain medications. We want you to tell us if the communication isn't going well. Don't be afraid. You can't offend us. We want to know your perspective and get to know what your needs are. And this is both for patients and caregivers. Some questions you can ask are, could I share my perspective with you? What do you expect from me? What do I do if I'm running out of medications? How does blood work at your clinic? When can I do it? Who do I contact if I'm not feeling well? Are there options for how you communicate with me by email, texting, calling? What do I do if an appointment conflicts with school, travel, or work? And maybe you're planning to go to post-secondary school. Is there something that maybe you should know to plan for that? And what do you do if you don't want your caregiver in the room for your appointment? We've heard that patients and their caregivers are afraid of being lost when they transition to the adult healthcare system, that the place and the people won't be as inviting or as caring. Caregivers often have very negative and inaccurate information about adult healthcare. They worry that they will be excluded from their child's care and that they will not be able to share information and concerns. Caregivers are concerned that adult healthcare providers will not attend to the emotional needs of their child. They feel like leaving a small, closer-knit family behind and coming to a bigger, disjointed team. But what it actually looks like is we're going to get to know you and work with you and acknowledge that this might take some time at the beginning. We ask our patients and their caregivers how they want to participate, and every patient is different. When we meet with the pediatric team, they let us know how much you participate in your care and what skills you're already coming with. Let me tell you about two different cases. Both of them were young adults that transitioned to our program while attending post-secondary education. At the beginning, caregivers were coming with them, and they eventually both finished their university and were working, and they're now in their mid-20s. One of them comes alone, and we only communicate with him. His parents are no longer involved in his care. The other patient still comes with her mom to appointments, and her mom reaches out to our team directly. It's a journey, and we continue to work with both and at different paces. No two families are alike, and we slowly work with our young adults to understand what self-care skills they are capable of and when to encourage them and what they're ready for. When we first meet patients and their caregivers, we're slowly getting to know them and slowly over time, they'll let us know if they run out of medication or if they need to change an appointment. So this comes with time. At our kidney clinic, the team is consistent. So your main contact is a nurse. Unless he or she is away, you'll have the same doctor, social worker, dietitian that you will get to know for consistency. At other hospitals across Ontario and Canada, there are different models of what that looks like. So maybe the kidney doctors rotate and there's a group of them, and you may need to be comfortable sharing your story. You might have to be ready to speak up, but most of the time your support team, your nurse practitioner, nurses, social worker, dietitians are consistent across the teams. The team allows us to address all of your psychological and social needs as you transition from young adult to adulthood while you're in our care. So dialysis, essentially the process is the same in that we're using the same principles when you transition over to our dialysis care. And Q talked about how that's changed over the last couple of years. With the only difference with pediatric transferring to adult care with dialysis is that there are many more adult dialysis units across Ontario and Canada in comparison to pediatric ones. So the benefit is that your travel time is going to be reduced when you're traveling to your dialysis appointments. It does require planning and maybe having a tour of the dialysis unit prior to transfer so you can meet your adult team. And we're flexible and we're able to accommodate all of your needs. Again, just ask us. So the take-home message is that we acknowledge that every patient and family is different. We work with each patient based on their developmental stage, and we're really guided by our pediatric kidney colleagues who have known you for many, many years. We encourage caregivers to continue to attend appointments and participate in the care. And no two families are alike, and we slowly get to know you, understand what self-care skills you have, encourage them, just like we do with our adult patients. So we are here to support, and really don't be afraid to ask us. Thank you. I'm going to hand it over to Brennan now to speak about his experience.
Hi, I'm Brennan. I'm 16 and I got my transplant in 2020. So when I was 12, I got diagnosed with the chronic kidney disease known as FSGS, which stands for focal segmental glomerulosclerosis. What it essentially means is scarring of the tissue in your kidneys. And when I was 13, I started dialysis. I was on dialysis for around 6 months. And then I got my transplant on September 16th, 2020. And it just happened to be my dad's. And now I'm going to turn 17 this year, and I'm 2.5 years post-transplant, doing amazing. So the concerns I have about transitioning to adult care is that I'll lose the nurses that I've known my whole health journey and that I have grown with. Just the people that I know by name, they know me, just the conversations we've had, all of that. I'm scared of what the new doctors will be like. I'm nervous to go to a new building and have to learn where everything is and just try not to get lost. I will also have no child life to help me with coping or distracting me with difficult things I have to do. And then there's no activities or games. I'm nervous that I have to go to appointments without my parents because my mom especially is good at knowing what questions to ask and remembering the information that we're given. I'm worried about remembering everything. I don't always understand what the doctors are trying to say or what they mean. I don't know what questions to ask. I'm nervous to stay over at the hospital without my parents. And the other hospital doesn't have many private rooms, so I will have to share a room.
Thanks, Brennan. I think a lot of the feelings that he has kind of overlap with how I feel as the caregiver. So a few of the things that I wanted to share are on the next screen. So just like Brennan said, we've kind of really become close with our team. So we're just nervous learning, you know, I'm sure the next team will be amazing. But just, you know, losing that connection that we've had for so long with the current team. We reach out to our team a lot. We always have questions and they're great at, you know, accepting calls or emails in between appointments. So, you know, I'm always nervous. I don't want to bug. I know how busy everybody is, but I'm kind of fearful that we won't be able to do that. Just nervous. And Anna kind of even alluded to some of these things, like nervous that, you know, once my child turns 18, you know, how involved can I be? I have a daughter as well. Brennan's sister is 19. So, you know, we already know that, you know, things change and she has, you know, her information and I can't necessarily access any of that. So we know we'll have to have a lot of conversation about what that'll look like for Brennan. Yeah, we actually go to the Children's Hospital in London, Ontario, and we will be transferring to another hospital within London. So it's not too far, but it is another building, just like Brennan said. Where he is right now, it feels like a second home to us. You know, he spent so much time there and we know where all the nooks and crannies are, where we can have some quiet space, where we can get our food, and it's just comfortable. So now just relearning a new building and where everything is just kind of worrisome. We're nervous, that the team, they have to kind of look back in through their notes, and they don't know his full journey and everything we've been through. So I'm kind of concerned about that. And yeah, I feel like at Children's Hospital, he's so closely monitored and so closely watched. And I'm just wondering what that'll look like in the adult world. So yeah, I appreciate being able to share our thoughts here. Some of the other things is that, right now when we have to go to the ER department, we go in through the ped side, and it's, very welcoming and user-friendly, and they get us in really quickly because of his, they triage him really quickly, and they kind of know us because we're in there a lot. So I'm just worried what it'll look like having to go in through an adult emerge department in a different hospital. Brennan is a little complex. He has some other medical issues that he has on the go. So just wondering, what is that referral process going to be like? We feel like things have moved very quickly in the Children's Hospital. And he gets kind of bumped up and has the ability to make connections with different departments very easily. So just concerned what that might look like. Just other random things like, will we have access to his blood work online? So some things are small, some things feel huge. I know Brennan struggles, as he mentioned, with trying to remember things. So just even understanding and knowing what questions to ask, or sometimes it's hard to have the confidence to ask for clarification. I also think it's just going to be strange, at Children's Hospital, we're supposed to stay, and we do stay bedside whenever he has an inpatient stay, but that won't be possible. And then we've also utilized services within Children's Hospital, such as the Ronald McDonald Room and the Ronald McDonald House. And those are also services that we won't be able to tap into. So even though it seems like we have lots of worries, concerns, and fears, we're preparing. Like, we really feel like we can do this. We're getting ready. So now that he's 16, we do always sit down. We always have a chat with my husband and I and Brennan. We always talk about things the night before appointments, and encourage Brennan to be involved in writing down what questions we want to bring to the team. We've tried to get Brennan to be part of the registration process. So even as simple as when we get there for clinic, have him take his health card and go up to the window and get registered. Sometimes that's tricky because it's always an early morning start. He's still waking up. We also encourage Brennan to answer any of the doctor's questions, and they are fantastic at, directly asking Brennan. They don't turn to us. They always start with Brennan, ask him how he's feeling, ask him if he has any current concerns. So as a parent, it's very easy. And when he was younger, I had to jump in and I had to explain things, and I had to add things, but I've really tried to take a step back and give Brennan the opportunity to learn how to do that and how to speak up for himself. And just really encouraging him to advocate. So he has sort of one thing he wants to share.
I always have to ask for a 1, 2, 3 countdown for my blood work, because I like to know that it's going. And if I don't say that, don't get it, blood work is even less fun than it usually is.
So that's been something that he actually, just because he frequently has to have blood work, he's learned what works for him, and he now has a voice. So as simple as anytime a new nurse has to do blood work, he always says to them, what works for me is I need that 1, 2, 3 countdown before this happens. And they're always just like, absolutely. So I think it's great because Brennan is already advocating for himself. And I think we'll be able to continue to do that and grow. We really are working on just building his confidence. He's getting better at asking questions and speaking up. And pretty impressive that he is on a lot of medications and he is able to identify all of them, list them off, and talk about the doses. So he's very familiar with that. And he's kind of all along, I think just because he was transplanted at, 14, he was old enough that we've started that right from the get-go, and he's familiar with it. We would love him to start putting his pills together. We encourage him to kind of prepare his pill boxes, and he does do that sometimes, but we are still kind of working through that and encouraging him to do that as a way to kind of move forward to independence. So I just want to say that what Q and Anna have shared is incredible. I think that the programs that they have in place and all the support sounds incredible. And I think that's the thing. I think we all have, as a parent or a patient, we all have all these fears. It comes down to the unknown and not knowing what it'll be like. So I'm very thankful for everything that they're doing. I know with our hospital, because each hospital probably does this differently, our nurse on Brennan's team, as I said, always speaks to him directly. But she's also shared that she will come with him to his first appointment at the new hospital and just help ease that transition. So we don't necessarily have a full transition team, but she's going to help us through that process. Another unique thing that Brennan has been offered is a referral to adolescent medicine. It's fairly new at our hospital, and basically they meet with him regularly and they call him in on his own. So he actually meets with the doctor for about half an hour on his own. They discuss everything, and then they'll bring me in or my husband in for just the last few minutes just to kind of summarize and things. So it's giving Brennan that opportunity to feel comfortable with going in on his own and having that independence. And what's great is that team actually does follow him up to age 25. So there's a nice overlap. But I think really overall, the hospital is great. We're kind of already planting the seed, talking about transition. We're kind of normalizing it. So I think that's really helping. And then I want Brennan to share what this picture is here.
So this summer, I decided I wanted to go to transplant camp, and it was a lot of fun, and we ended up going sailing. It's not easy. It's very difficult. We almost flipped over a couple of times, but it was really fun.
And this was something that Brennan had never done before. That opportunity let him try sailing and doing some paddleboarding, some other great things. So I think we as a family are going in with the perspective that change is good, and trying something new is good. So we definitely take things in stride, and Brennan and us as parents are very open to trying new things and seeing what adult world will look like. So thanks. I'll pass it back over to Anna.
Thank you, Tina and Brennan. That was so nice to listen to, and your experiences and those fears. I just want to help you just to alleviate all those fears. So thank you. It's time for our fireside chat, where you get an opportunity just to share your experiences. If anyone wants to share, they can raise their hand, and maybe if your experience is similar to Brennan's or how it's different, or from a parent or caregiver such as Tina, and how that's going. Yes, so there's a question here from Joanna, and it says, is there a connection to these transition clinics for kids transferring from London Children's to TGH? So just to clarify, this is for a chronic kidney disease patient. I don't know if you're able to clarify just the context of this, Joanna.
Joanna, are you able to see Katie?
Okay.
Oh.
Okay, thanks, Joanna. So every adult hospital would have a CKD program. So if you live in London, then London would have their own CKD clinic there. So you wouldn't necessarily transfer to Toronto General Hospital. We were only talking about what it's like in Toronto. From the Children's Hospital in London, you would transition to the London Health Sciences kidney program there, and they have their own kidney clinic structured in the same way that they are at Toronto General Hospital. So I'm wondering if that answers your question.
Okay, while we figure that out, there is another question, and it's for Brennan. So, Anna, go ahead.
Yeah, so Brennan, what do you tell other young people living with kidney failure when they need advice or support? I imagine you speak about your lessons learned. So how you speak to other patients for advice.
Big question. No, I just tell them to try and keep like a positive mindset because it will get better. I know there are like some very tough spots in everybody's journey. So just trying to stay positive and making sure that the people around you know what's going on and just feeling comfortable.
Brennan has actually just been trained too to be peer support. So I think that's great because he will have the opportunity to kind of chat and support others, whether they're just starting dialysis or the transplant process. So
maybe just to address some of the things Tina talked about, which I think are also important, you know, the fear of the unknown isn't only unique to kind of transitioning from pediatric to adult hospitals, but it's the same case when we have adults starting dialysis for the first time unexpectedly. And so we have a whole team of healthcare people looking after somebody like that because dialysis to them is unknown. And it's the same support, so we kind of can understand what that feels like when you got admitted and now you're on dialysis and your whole life has changed. So very similar principles apply to that. And I think just what you said about, you know, normalizing the transition that it's coming and just how you involve Brennan in his care is really the way to go. So thanks for doing that.
So there is an update with Joanna. She has asked her daughter's transferring to the heart transplant program at TGH. So her CKD care is going to move there as well. So that's what she was referring to. Oh.
So just to speak to that a little bit, because I work with the heart transplant patients as well. Depending on where you are with your chronic kidney disease journey, some of your care may start off with at Toronto General Hospital. And if the plan is for another kidney transplant, you may stay here in terms of getting another transplant. But sometimes for CKD care, we like it to be closer to home. So we would refer to the London CKD program. It's a little bit different for kidney care because there are many more centers in the communities. And I think I wanted to also address that with Tina in terms of resources. You know, in terms of access and timing, is in pediatric hospitals, there are less patients, less staff, but in adult care, we actually have more patients, more staff as well to accommodate that. So there aren't really those wait times as well. So I wanted, in terms of seeing the dietitian, and same like in pediatric where you call us and email us, we're getting back to you quite quickly. And just to compare even to the adult world, you know, we have patients whose parents are patients and they are speaking for their parents. So it's something we're familiar with on our adult and older adults as well. Okay, sorry, go ahead.
I wanted to ask you this question from someone, because it's
Yeah.
towards you. So Anna, what do you find so compelling about supporting young adults in their transitions? What is challenging and what is rewarding?
Mm-hmm. I think for me is because the number of patients we've transitioned from sick kids to TGH is just a small group that I remember all of them. I remember all of their stories. And because we've been doing this now for almost 10 years, you know, now they're in their 30s and they've had transplants or on dialysis or wherever their journey is. So it's so nice to see kind of where they've gone and how much of their care they're dealing with independently. So I think that's the most rewarding, is just how far they've come throughout, you know, their care with us. And even though, you know, we're a big place with a lot of people, our patients travel through our different departments, and it is still a family. Patients come back to visit us. So you do eventually get that sense of family as well in the adult healthcare system.
Can I throw that question to Q as well in terms of her journey with being a social worker to kids?
Yeah. I think what I find the most compelling when working with our young adults or or transitioning teens into adulthood is their resilience, especially our kiddos who come from CKD and go to dialysis. You know, they've really have been hit with a lot, and their resilience, I continue to be kind of astonished by how quickly they're able to like adapt and, you know, navigate the uncertainty, and sometimes they do it better than their parents. You know, they can make shifts that are more flexible, and really can, you know, throw things back at our face and be like, I can do this. Like it's really inspiring to see, you know, amidst all the adversity that they're dealing with, how resilient they are and how willing they are to do what they got to do to continue to manage their health on their own, while also living normal teenage lives to the best that they can. So I find that to be the most rewarding. And I think challenging is, you know, you get so close to these patients when they leave, it's hard to say goodbye. I think that might be the most challenging selfishly. I'm always happy to see our patients, you know, move forward into the next phase, but it's sad to see them go, because you establish such a good rapport and relationship with them. And like when you see them go through CKD, dialysis, and transplant, you feel like you're a part of their life. So it's hard to all of a sudden see them kind of go, but that's more selfish than anything.
Yeah, in terms of challenges, because I don't think I answered that, I think the challenges are, you know, we come up with a plan, and, you know, we've established that our young adult is going to do this next time, and they're going to take ownership of it, but it doesn't happen. And so that's a challenge for us. So every time we have to just relearn and figure out a new plan. And it's the same for our adult patients, our older adults, it doesn't change. But, you know, it's, even if we have a plan, it's not necessarily going to follow through, and it's going to look exactly what we thought it would. So just being flexible and willing to look outside the box of what we can do to support somebody. And if it means just their parents taking over for a couple of years, we're totally fine with that too. So, yeah.
And Tina, you did mention about even the emerge and whatnot, how it's a new kind of environment. Can Anna speak on that? Like, it's the ebbs and flows of just learning again about the whole process in the adult world.
Yeah. And so just to speak maybe to a couple, and then maybe Sarah, you can just redirect me, but In terms of adult care, we do have some of our patients, their parents or spouses stay with them overnight if it's necessary. So it's not like a hard no where the parents can't stay. And we have many, you know, all multi-organ transplants where their parents are still very involved. So it's very flexible. We never stick to things and not change. So I think just be reassured that we'll listen to your voice and your concerns and try to help you as much as possible. In terms of emergency departments and that, yes, they're busy. There's a lot going on. But you know, you have access to kind of the same supports with social work, with nursing, where there's all those support team members to help you through the journey, and we'll get to know you as well in your needs. Yeah, I don't know if that answers the question.
So there is a question from an unknown person. So it's directed towards me. So I did transition from sick kids to the adult care in my time. So I am a kidney patient. So I'm wondering who this person is. So for me, we didn't really have a transition to TGH at that time. I'm aging myself quite a bit. But the team was still nonetheless amazing at both locations, sick kids and Toronto General. I think for me personally, it's a lot of the same concerns that Brennan had expressed, but it was also not being as shy in asking my questions, and I guess taking lead in my care, which I did at sick kids. But when you transition to an adult care, you get a bit smaller. Because everyone's a lot taller than you are, and your voice does shrink a little. So I think just that empowerment and knowing that the other patients there are your friends, it's a note, okay. But either way, the transition program is great, so fully support it at the end of the day. So thank you for that question or that note. Tina or Brennan, do you have anything else to add?
I just think this conversation is so important, like for everybody involved, because, you know, it does reassure the patient, it does reassure the caregivers, and how great, I mean, we know how great our team is, and I really don't doubt that where we head to will be phenomenal as well. I'm an information person, so I think even things like this is so important to increase awareness and have conversations. You know, even connecting, Brennan has, through his volunteering, through going to transplant camp, like through all the things that he has participated in, he's made connections with other kidney kids, right? So he shares his thoughts and everything he's been through with others, so he doesn't feel alone. And I think knowing he's not alone feeling this, moving into adult care, is important too. Does that make sense? Yeah. So I'm thankful, and I hope that this webinar and everything that you have shared is helpful to others in preparing.
Are there any other caregivers or parents on the line that maybe that want to share kind of like their biggest fear, or what they're nervous about in terms of their child transitioning to adult care? What keeps you up at night? Just to address something that Brennan and Tina talked about, like all the programs that are available in pediatric hospitals, you know, to like help entertain you. That's one of the things we address in transition clinic, is that we don't have all the fun things in the adult world, unfortunately. So we encourage patients to bring their own entertainment because our appointments are long. So, you know, we say like, bring your iPad, bring your cell phone, whatever you need to entertain you. so that it doesn't feel as long. So we do acknowledge that, yeah, there aren't as many fun programs. Q, I don't know if there's something that you kind of do on your end to prepare for the shock of not an entertaining place.
Not really, other than also just kind of shed light on the fact that they won't have access to like our Marnie's Lounge or Samsung Space or the Ronald McDonald Room, those things that you touched on. We let our patients and families know that they won't have access to that, but certainly most of our teens come with their phone anyway to clinic or a book, so they're kind of familiar with wait times and are well prepared to entertain themselves.
Is there maybe something you can share with parents that you found that you've had success with in terms of helping Brandon transition?
I think just in helping him, my biggest thing is stepping back and letting him kind of speak up in that, not automatically jumping in. So I think that was something I had to learn to do for sure. And I think that it's a hard thing for a parent to do, especially when you start young and that's what you're used to. You have to advocate, you have to ask the questions and whatnot. But I think that's one thing that is really helpful for Brennan, is that now it's up to him to communicate. It's up to him to answer their questions. So I'm there to help him if he needs help or needs clarification, but he is gaining the confidence that he needs as he moves into this. Yeah, he's definitely talking more to the doctors. There's more conversations. He asks more questions. He feels comfortable if he doesn't understand something to say, what does that mean? I don't know what that word is, or what is that medication for? So
just to add to that, I find that like our patients who we've kind of started the switch from, the patient taking control of the clinic, we let them know that it's okay to fail. So like or like not have the answers. So if they don't have the answer and they're not prepared for a specific clinic, that's okay. But I find that them not having the answer, not feeling prepared, triggers them to come to the next clinic even more prepared. So it's kind of like they have to see what they're going to expect, or go through what they didn't have the first time to really know what they need the second time. And you really see that shift and like the willingness to come and say, okay, I followed up, I have all these answers, and they feel good about themselves in doing so.
And just to speak from the adult side, is because we have experience with patients of, from different educational backgrounds, different social economic backgrounds. We have patients who have really low health literacy. And so it keeps us on our toes so that we're treating everybody differently. So when we have a young adult with us, we can utilize some of those skills and help you understand what's happening and build that appointment to appointment. So you don't need to be perfect on in the first visit or in the first year, but it's something that we continue to work with you and so that you're the expert at the end of this. And you know more than we do. And that's always the case. We're not going to know your whole story, but we're going to remember the important parts. So, help us to fill in the blanks. Yeah. Do you maybe have some young adults on the call who want to speak up, or have your caregiver speak up in terms of what you're more nervous about, or maybe something you're excited about in terms of transitioning to adult care? And you can just type as well. Sadia, I don't know if you're getting any questions.
Nothing at the moment.
Mm-hmm. We'll maybe give it another minute to see if anyone else has any questions. Maybe I don't I just wanted to think some of the things that Tina and Brennan mentioned. I think one of the things that stood out for me as well was the in-between clinic, and that's something, the contact in between clinic. And at our CKD clinic, at our kidney clinic, we do most of our work actually in between your appointments, because so much happens in between. So we actually encourage you to let us know. So we do email, phone calls, and we're, our patients, aren't happy if we don't respond to them within an hour. So we have some high standards to abide by, but we're pretty quick on our end as well. And we review some of that, how quickly you can expect us to respond depending on the urgency. But those are, like I said, when you come to the adult side, if that isn't reviewed by your adult team, speak up and ask how do you want me to communicate? What if it's more urgent? What if it's less urgent? So yeah, speak up. Or if you can't, then your parent or caregiver.
Thanks, Anna, for saying that. I think that, when Brennan has an appointment, I feel like they keep stretching it farther and farther apart, which is a great thing, right? Because I feel like that's a positive thing. He's doing better. Yeah. But there is always, with this journey, there's always bumps in the road. So I think just having the knowledge of what to do if we hit that bump, and our appointment is not for another month or 2 months. So yeah, thank you. I think just being able to, ask the team and clarify what do we do in those moments is important.
Mm-hmm. Mm-hmm. Any, oh, go ahead, Anna. Oh, I was just gonna ask you a question. Any advice for young adults that are transitioning from dialysis to the adult dialysis program and how they're navigating that world with other folks, and also when they're juggling, school, work, everything? What's advice, or what have other patients of yours done to support them and empower them in that journey?
Mm-hmm. I think that the challenging part is, when we have patients transition on dialysis, especially, hospital-based dialysis, and they're managing school, or maybe they have a part-time job. And I think that it's the same thing where we need to be flexible. So, assigning you a dialysis schedule that works for your school, if that's online or in the evenings. And what I always say to patients is your life comes first. So whatever your priorities are, if that's school, work, family, and dialysis comes second. And we need to be able to prioritize whatever is important to you, and we'll make dialysis fit around that. So that's kind of my message to all of my patients, because I know dialysis is hard and takes a lot of time. It's like a part-time job when you're coming to the hospital. What the patients have told me is kind of the same thing that we hear from patients that are coming from sick kids, is your dialysis unit is like your family. You're seeing the same patients on that same shift all the time. You get to know the patients and their families, and the staff are also getting to know you. So with hospital-based dialysis, it's really that support is there. You're there 3 days a week. So those are the people I would say get to know you the best, and what your special needs are, what you're afraid of, and things you want to do and travel. Anything else? Sorry, you wanted me to answer, Sadia, about dialysis?
No, that's perfect.
Okay. It's a little bit different. I would, if you're transitioning onto peritoneal dialysis, obviously peritoneal dialysis, that allows more flexibility in terms of scheduling. So if you're in school, working, that makes it a little bit easier. And it's the same for adult patients. So, you know, there's in the adult world, when you transition to us, we're going to be talking to you about what all of your treatment options are, whether that's transplant, whether that's dialysis, and reevaluating to figure out which dialysis fits with what your life is now as a young adult and in your next phase of your life. And what I tell all of my patients again is that, you know, you can try one therapy. If you don't like it, switch. So, you know, you're not locked into anything for a long time. You're always able to switch. So those are kind of my messaging, but, that's not specific even to young adults, but to all of my patients. I don't know if maybe you want to just address like in-center dialysis and transitioning to adult care versus maybe peritoneal dialysis.
I think we've transitioned a couple of hemo patients, and I think, like Anna said, it's hard when they're still in high school because sometimes they're 18, but they're still finishing off their high school year. So it's about finding a schedule that works for them in school. Like, luckily with COVID these past few years and things kind of being remote, it wasn't too much of an issue like last year or the year before, but certainly this year, you know, finding a schedule that works with our patient and the team has been somewhat challenging, and also like they feel like they're losing their home base with us here at Sick Kids. With peritoneal dialysis, it's adjusting to a new team. Things are run relatively similar to our clinic here. So the transition, you're still meeting a new team and new faces, new hospital, but the care that you do at home is kind of maintained throughout PD in pediatric versus the adult side.
Yeah, I don't know if we have any patients or caregivers who are transitioning maybe on dialysis on the call, if they have any fears, because we've focused a lot on kind of kidney clinic and CKD transitions. I think the other thing just to keep in mind kind of as you move through this journey is that, you know, there's some things you might have learned during this forum, and maybe if it's time for you to be thinking about transitions, or if they're coming up and you haven't heard anything, you know, speaking up and saying, hey, I heard about these transition programs at these other hospitals. You know, do you have something like this? Or maybe you should speak to the other hospitals to see if this is something you can do. So advocating for yourself as well to have the best experience. And, you know, we like to hear from patients, and because you're the ones receiving our care. So it means a lot if you're giving us feedback and giving us ideas for change, because that's really the most impactful.
Okay. So any last words from any of our amazing speakers and our amazing moderator?
I just want to say, yeah, thank you to Anna and Q for doing what you do. Your impact is just, I can't even explain. Just what you do is life-changing, right? And making these families feel comfortable during this transition. So on both sides, I think it's very encouraging that this is out there. So thank you for what you do.
Thanks. Q, do you have any last words?
I just want everyone, like our patients and families, to know, you know, sometimes, like Sadia, you had mentioned, you know, you feel like when you transition, you feel smaller, even though you're empowered to kind of have a voice. But I just want you guys to know that we value patient and family feedback, and really to want you to recognize how vital your role is, and that you are a function of the team. You're not someone that we work with, like we don't work as a team without you. You're a part of the team, and what you have to say matters, and your input matters, and we can't be prescriptive or pathologize what we think is going to work without what you have to say. So you're just know how important and crucial your role is, and how seriously we take into consideration and include your voice and input into what we're doing day to day.
Yeah, thank you, Tina and Brandon, for sharing your experiences and your fears and anxieties about what's to come, because there are probably others on the call who are feeling exactly what you're feeling. So thank you for sharing those with us, and thank you to Q for talking about what happens in the pediatric side. Thanks.
Perfect. Thank you, everyone. And Anna, thank you for sharing your amazing knowledge and your empathy towards, you know, these young adults transitioning into a bigger world. Please visit our website, of course, and email us if you have any questions at kidneyprograms@kidney.ca. And of course, we do have our virtual pediatric caregiver support group meetings as well. They're open. Please join. You can talk to amazing facilitators like Tina and our other one, Kristen. They're all once a month, and they're available nationally. So thank you. And next we have is our networking session. So please join that at 6:35. So we give you some time back. Thank you.